Migori County has an annual growth rate of about 3.8% according to the Kenyan Census 2009. This is slightly more than the country's 2.9%. Bordering 3 counties, the expansive Lake Victoria and Tanzania, Migori is a budding cosmopolitan area attempting to live up to its slogan, a jewel in the making. The county ails from teething issues of maternal and infant mortality.
Infant mortality ratio, according to the census, is around 108,000 live births, but we approximate it to be around 173. For only 10 children who are born, 1 will not make it. According to the Kenya Demographics Survey 2014, Migori County has among the highest neonatal or newborn and maternal mortality rates in the country. Newborn infection is the second leading cause of death in children within the first 28 days after birth asphyxiation in the county. UNICEF puts the number of children under the age of 5 who die globally at over 5.9 million. 44% of these deaths occur in the first 28 days of a child's life. Almost 2.7 million newborns die every year, and almost a quarter of these deaths are due to infections. We arrive at Kurunyere village in Kuria West.
Nitahakikisha nimenawa mikono. Kwa maji na sabuni, ndiposa nimshike mtoto wangu.
This mother-to-mother support group program, a private and public partnership by the county government and developing partners, aims to impart hygiene knowledge to mothers.
After that, you do this way.
More specifically, hand washing with soap to reduce infections to newborn babies and children below the age of 5.
You know, when a baby is born, is where the cord is. And as before it heals, if it is hardened with unclean hands, the mother has not cleaned their hands, then they touch that cord, they can get what is called cord sepsis or cord infection, and then that spreads to the entire body.
Mwita Anastasia Boki is one of the 40 community health volunteers that play a role in reaching the women in this area. The situation was grim in the past.
Mtu alikuwa anaenda na mtoto shambani, anamweka chini, anapalilia mtoto akilia, ni kutoa huko kunyonyesha, na mikono chafu, napata mtoto wa mwezi moja anaharisha.
Tulikuwa wachafu zaidi. Baada ya kufunzwa, ukweli mimi nimeona ninapiga hatua kidogo.
Esther Mokami has had a fair share of bearing the disease burden with her first 4 children. But for her 5th and last born 3-month-old daughter, the simple act of hand washing has saved her trips to the hospital.
Kama hana sabuni pale kuna jivu, sabuni kwa nyumba. Hata mkitembelea hapa miji yetu wamejitahidi sana.
If you look at the numbers, it's like 11% or a certain percentage of them don't wash their hands after using the toilet or before eating food. So food poisoning, diarrhea, pneumonia, whether or not you have access to the facilities or to the products, keep in mind it's about the habit.
In terms of the diarrhea for under 5s, it's actually the second leading for morbidity and mortality after malaria.
In these rural areas where soap is more a luxury than necessity, mothers have improvised a pedal-operated running water system and ash to clean their hands. A more affordable option that serves the purpose of ensuring the young ones stay safe from a number of infections. This weekly meeting, scheduled for Saturdays in Kurunyere village, brings these women together in order to learn more about hand washing and how they can make their babies safe. Eunice Omolo, NTV in Migori County.